With summer on the way, get ready to sweat. It's inevitable. And for some of us, that extra sweat can aggravate a skin condition called HS. Dr. Summer Moon is here to explain what it is, how the condition progresses, and as always, how it can be treated. And Summer Moon of Bay Dermatology, the 5 years in a row winning this award of Best Dermatologist. So great job by you guys.
We love caring for people, yeah. So,
fantastic.
So HS is called Hidradenitis Suppurativa. You can say that 5 times fast.
Well, I was going to leave you to say that. Thank you.
But it's kind of this inflammatory condition on the skin. It usually, shows up in the folds. So under the armpits, it can even be in the groin area, underneath the breast, even in the rear end area, all kind of very sensitive areas. So it's really a challenging condition because it's an inflammatory condition on the skin, and most patients wait, unfortunately, too long to come in to see a dermatologist.
There's probably some embarrassment trying to figure out what it is, but if you have those patients come in sooner than later, they're going to be able to get the help that they need. What kind of treatments are available?
Yeah, so there's lots of treatments for HS. The first and most important one is kind of the conversation topic with the patients, which is a very hard one. It's stopping smoking and also exercise, because the skin-on-skin folds and the chronic inflammatory condition on our skin leads to kind of a move towards, like, we have this Hurley stage where we talk about where we have Hurley stage 1 and it goes all the way up to Hurley stage 3. By the time you get to Hurley stage 3, you need surgery.
And those are the different stages of HS. That's how it progresses.
Exactly. So we want to catch it even before it hits Hurley stage 1. And so the best time to come in is when you kind of have those blackheads that are kind of in areas that you wouldn't normally have, underneath the armpits, in the groin area. And honestly, patients are really sad about this condition, so they think they need to wash and scrub more, or they think they're dirty, and it's not a dirty condition. It's actually just an inflammatory condition on the skin. So it's super important to come in if you have any of these spots like this so we can look at it.
And quite honestly, if you are washing more, you might actually aggravate it more and make the condition worse, since it is inflammatory. What kind of things can be done at home to take care of it? And again, at what point do you need to say, oh, I need to get in and see a dermatologist?
So at home, typically people usually come to the office and they've already tried benzoyl peroxide or kind of these, harsh chemicals on their skin, because again, they're kind of thinking this is a dirty condition or something that I need to get off my skin. But that's when we want to catch it early, because we can do topical medicines, we can do oral medicines, we can even do things like now we have biologics, which are wonderful. That's kind of the latest and greatest updates on HS. We have these biologics. The first one was called Humira, and then the second one's Cosmetic, and now we have this one biologic called Benzelic, which actually helps with those pimples. So when they do get irritated and inflamed, it actually decreases the pain and the inflammatory response on the skin. And then if you let it go too long, then it's surgery. So it's really important to come in soon.
There's definitely benefit to getting seen. If you have a suspicion that that's what you have, just get in, make the appointment. And so many options nowadays. We do want to let our viewers know where they can find more information, how they can make appointments with you. And that is baydermatology.com. But it is so important to get in there. There you go. You can also call 727-585-8591. And Dr. Moon, I love your bedside manner just with talking to you in our segments. It's a comfortable process if someone comes in and has that condition.
Absolutely, and that's what breaks my heart is usually when patients come in, they've already, been worn down, they feel really awful about their skin, and when you can actually have a solution and a treatment that helps their condition get better, it's like the world changes. You see them on a follow-up and it's like they're smiling, they're happy, they can do their exercise, they feel better.
Relief.
Yeah,
Thank you so much. So appreciate you being here today.
Thanks for having me.